Hi there, how's it going? So I was just about to sit down and have a cup of tea, but I think I'll just pull up a chair and chat with you for a minute instead, because something's been on my mind and I'd like to share it with you. And that is that entrepreneurship can be really hard. It's way harder than sometimes it looks behind the scenes. But I wanted to share with you a little bit about what drives me to continue on, to keep going, even when it gets hard, so that perhaps you can see me a little bit more as just a person rather than a business or, someone who's different than you. Because at the end of the day, we're all just human beings doing our best to do our best, right? But before I share my story, please don't forget to subscribe and hit that notification bell so that you get a little notification each week when we release our fresh new content. So these days I am considered an expert in non-invasive pain relief. I used to think that the only way to help someone relieve pain and stimulate their ability to heal was to poke them full of little needles. That's right. From acupuncture to neural therapy to trigger point injections and dry needling, I used to think literally that I had to just stab them a bunch of times in order to help them heal. And I discovered that that's really not the case. When I decided to start using dynamic neuromodulation on my clients first, I discovered that I really didn't need to pull out any of the sharp sticks anymore. You see, I spent 8 years running a primary care practice with this emphasis on pain relief, and a medical assistant and I would run circles around each other, running 2 rooms, doing these types of dynamic neuromodulation treatments on people. 2 rooms a day, all day long, 5 days a week. That's a lot of people. And it was during those moments of working with clients and watching them heal faster than I ever thought they could before, all without puncturing their skin, I realized I don't need to do invasive procedures on people anymore. Now I teach home users and medical professionals how to use this technology in the comfort of their own home, in their office, in their own time. They get to go through my entire video library of head-to-toe techniques in how to utilize these amazing little space-age devices to get the best results for themselves at home and for their clients in the clinic. And I'll let you in on another little secret too. So these devices are FDA cleared for acute, chronic, and post-operative pain. But what I've discovered is that they can do so much more than that. And they're considered off-label uses that I'm only allowed to share with my private clients. So when people come into the Pain Eraser program, we talk first in terms of drainage. What can we do for, the gut, for the liver, for the adrenals? What can we do to get those organs going? And then in terms of the central nervous system, your brain and your spinal column, where within that central nervous system could you use the most help increasing your neuroplasticity? And then what local area do we need to work on right now? Is it those arthritic knees? Is it that frozen shoulder? What area of the body specifically needs the help once we've really primed the entire system? I love the fact that I get to meet my clients one-on-one in a Zoom meeting and really get to know them and their health goals before they just, pick up the space-age device and try to figure out how to use it. So that, I can look at them and I can help them design a flow of how they might treat themselves to really get the best benefits of this technology. Because I'm a healer by nature. When I was 3 years old, I used to take care of my baby dolls. And then when I was 6 years old, I used to follow my brother around with a little medical bag that I'd made myself. And he would have his BB gun trying to shoot birds, and I would have my little medical bag trying to heal them. Little did I know that someday I would be carrying a real medic bag for the United States Army, serving as a combat medic for 18 months in Iraq. I have prayed to be an instrument of divine will since I was in my 20s, to try to get my own ego and my own brain out of the way and really allow, I call it God, whatever you want to call it, to work through me so that I can benefit humanity and this planet to the highest extent possible. And I want to share with you a little story that it still blows my mind to this day, and it might blow yours, just to help you kind of understand the types of miraculous life experiences that we can have when that's our MO in life. So this was a while back, but I was in my clinic as a doctor, and I was sitting with a Native American gentleman whose wife had sent him in for a routine yearly physical exam, and he was grumpy. He was not happy to be sitting in my office, and so we'll call him Harry. You know, okay, Harry, everything checks out here, everything checks out here. There was no complaints. He said everything was perfectly fine. And I took a moment and I just kind of took a breath, sat back, and just sort of looked at Harry and listened for a minute to my intuition. I don't know what I was listening for, but I heard, this is where the story gets really crazy. I heard a little voice whisper into my left ear, clear as day, "Harry has cancer." And of course I didn't, let Harry know what I had just heard, but I said, "Well, Harry, I have these sharp sticks in my drawer and all these vials. Let's just draw some blood. Let's send it into the lab. Let's just get a good baseline of labs on you, okay? And I'll check in with you tomorrow." And so I sent his blood into the lab, and sure enough, it came back with severe iron deficiency anemia. And if you know anything about cancer, you know that cancer sequesters or consumes the iron in our bodies. So that next day, he was getting referred off to hematology, oncology, and they rushed him right in for a colonoscopy. Now, Harry had had a colonoscopy 2 years prior. They'd found some polyps, they'd snipped him out. He wasn't due to go back for another colonoscopy for another 3 years. But in this colonoscopy that they rushed him into, they found a 12.5 centimeter invasive adenocarcinoma in his colon. That's right. And they were able to go snip, snip, sew him back together, no chemotherapy, no radiation. Harry walked out of that hospital a day or so later, basically a healed man. And 1 year later, he did have one solitary lesion pop up on his liver, able to go in, surgically remove that. Again, no chemotherapy, no radiation. And that was almost 10 years ago. And do you know that that man is alive and well today? So the physicians at the hospital that I'd referred him to, they were fascinated with this case. How did I catch this so early? And they wanted me to come in for their grand rounds and talk about how I caught this cancer. And I laughed and I said on the phone, I'm happy to come share my story, but I don't know if you're gonna wanna hear it, because honest to God, I think an angel told me. Click. That was about all they wanted to hear from me at that point in time. But, that's just an example of, what do I mean when I say that I look for modalities. I look for ways to treat and to heal the whole person. Mental, emotional, physical, not just let's treat this one body part and get this body part out of pain. But, how do we help improve the health of this person as a whole? And as a result, my clients come to me and they tell me that they are sleeping better than they have in 20 years, that their libido is better than it's been in a decade, that their energy is amazing, that they can bounce around at work all day now and their knees don't hurt, their energy is awesome, and then they're able to go home and get the best night's sleep. So that, my friends, is the reason why those moments when entrepreneurship is really hard, when the marketing is really hard, when owning a business is really scary, those are the moments that my clients come back to me and they tell me their experiences, and that's what keeps me going. That's what drives me to get up every day and make it a better program and serve my clients in better ways. And if you're a doctor listening to this, my only suggestion would be to never forget the importance of listening. Not just listening to your client, but slowing down for a second, taking that deep breath, sitting back, and listening to your intuition. Because most of the time when it comes in your office and it looks like a horse and it sounds like a horse and it smells like a horse, it's a horse. But every once in a while, it's a zebra. So I'll admit, the other day I was scrolling Facebook and this picture jumped out at me. It said innovative women in pain management, and it was a picture of these 4 beautiful, amazing looking women, and I thought, I want to be in that picture. I'm one of those women. And then I looked a little bit more closely into what it was all about, and it was the Society for Neuromodulation, but they were all surgical implantations. This was all about women who do the surgeries to implant the spinal stimulators into people's spines. Now, I could have been a surgeon, but I chose the healer's path. I chose to try, instead of, surgically trying to fix people, I chose to try to fix people in a more natural method. And for just a minute, I felt that imposter syndrome of like, oh, I'm not a real doctor because I'm not scrubbing in and implanting these things into people's nervous systems. And then I remembered, oh yeah, but my cousin was in the army and he had one of those things implanted, and he was saying for 2 years that it was shocking him and that it was causing all of this pain, and no one would believe him and they wouldn't take it out. Finally, 2 years later, they took it out and the doctor said, well, yep, you were right, it's broken. This wire here was, not attached properly and it must have been arcing into your body. Boy, that must have really hurt. My gosh, right? And I remember the people who we've talked to through the years about this program who have had spinal stimulators implanted into their bodies that have failed to work. So then I remembered, oh yeah, I'm helping people relieve their pain, manage their pain, sometimes even resolve a good portion of their pain non-invasively, using something that they can use in the privacy of their own home, day or night, that doesn't come with all kinds of side effects, that doesn't come with all of the risks. And then I realized, yeah, that's right, that's my why. This is my mission, and this is what I feel like I have been put here to do. So I just had to share that with you today. And if you're listening to this story and you're interested in learning more about the program that we run, the My Pain Eraser and Rapid Recovery Program, all you have to do is click on See More in the description, and you'll find the link where you can go register for the webinar that we created that explains everything you might possibly want to know about the program, everything that you get and what it all looks like. And if you're a health professional who is, kind of struggling with maybe feeling that call that you'd like to do something for your clients that's non-invasive, that gives them great results, that you can do with your medical assistant, the Pain Less Prosperity program link is also down in the comments. And so I have to ask, what is your why? Why are you here watching this right now? What is it that you want out of your life? What do you want to be different? Let me know in the comments. If you want to help get rid of your knee pain so that you can go hike in the Zion Narrows, I want to hear about it. If you think it would be a dream come true to be able to clean your house and then go for a walk around your neighborhood and then play with your grandkids at the end of the day, I want to hear about that too. I want to know what makes you tick and what you're looking for in life so that perhaps we can best support you too. And if you enjoyed hearing my story today, please hit the like button and leave me a comment to let me know about it. And if you'd like to take a deep dive into the different ways that we can achieve longer lasting pain relief and hear about all of my favorite modalities, click on this video next. And if you're interested in learning a little bit more about our super space age technology and how dynamic neuromodulation can outperform a traditional TENS, this is a great video that will help explain all of that to you. So thanks again for watching. I wish you optimal health and happiness, and I can't wait to see you next time.